and today I just want to discuss about the polio vaccination for children under 5 years of age. First of all, the importance of polio vaccine is to prevent, you know, because of polio virus, children get affected, um, soon after birth or in the early stages of their life. So, in order to prevent paralysis and in order to prevent deformities, in order to prevent death and all, we used to give oral polio vaccine since long ago. Okay, so now I just want to tell you about national immunization. National immunization programs are being conducted by the Indian government. So, like that, national pulse polio immunization program is being conducted by the Indian government um, on 28th, 29th, and 30 June of the year 2026. Guys, um, since 2022, I have been observed that there is no birth dose vaccination for the children or for the newborn babies. I've been observed since 2022, and not only that, um, government and health ministries are also like stated, and they have been also noted that only 66% of birth dose vaccines are giving. Okay, only 66% of birth dose vaccines are giving. So please kindly make sure that each and every newborn child should get their birth dose vaccination. Either it is polio or polio vaccination or BCG vaccination. Okay, these two are very important, and not only that, today I just want to tell you about, please encourage pulse polio vaccination, because each and every child life is very precious and we need to protect them. Each and every child is precious and they deserve a better life and quality life. So we need to protect our child. You know Not only the last past generations, we have done a very good immunization programs, and we always success, and we also get the we also already have this elimination certificate of polio, polio free certification in India. So for India is already there. So in order to maintain that polio free status, we need to we need to vaccinate each and every children, and always keep it in our mind that uh, vaccination, not only birth dose vaccination, we need to follow the schedule of the vaccines. Okay, each and every mother should aware of the vaccination schedule of the children, not only polio, not only polio vaccine, or not only other vaccinations. So they need to thoroughly uh, have the idea of immunization schedule of the children until all vaccination schedules should be completed in time, along with the booster doses. So, and governments or in government hospitals or in private hospitals, there is cards, there is a card regarding immunization schedules, and when to visit, what are the doses and all, and everything is mentioned in the in OPV cards or immunization cards or mother case sheets and all, everything. Government provide a clear schedule to the mother and parents, and for the children vaccination and all. So please try to each and every parent try to uh, like uh, give a proper vaccination to the child is very important. Okay, coming to the pulse polio vaccination, yesterday is an uh, very successful day actually. Almost according coming to our state, 95% of vaccination done today. Household surveys are being conducted. So if anyone who got who missed yesterday's vaccination and all, please stay at homes. Every Anganwadi member, Asha member, ANMs, health secretaries, medical officers, doctors, nurses, each and everyone, are trying to give vaccine to your child. Today is the door to door survey is being conducted. So if anybody missed yesterday's vaccination and all, please try to available at homes to get vaccine. And I just want to tell you that see, each and every mother try to give the birth dose, try to make ensure that baby get the birth dose of OPV vaccine, BCG vaccine. And not only that, try to remember the vaccination, for each and every student or medical student, everyone. It is helpful to remember the vaccination schedule. It is easy. Birth dose 0, and next dose is 6, 10, 14, and 16 months to 24 months. So in order to remember that, OPV vaccine, like 0 dose, 2 drops of polio vaccine we will give. And first dose we will give OPV plus IPV of zero point 0.5 ml. It should be given to the anterolateral thigh of anterolateral thigh of anterolateral thigh, to the vastus lateralis muscle. So IM should be given. Baby is under 1 year. So it is the first dose. And after 10th week, you have to give second dose of OPV. And after that 14th week, you have to give a third dose of OPV plus second dose of IPV. Both should be given after 1.5 years, that is 16 months. It should be given 1.5 year, and second year of the baby. You need to give your OPV and IPV boosters. Okay, and after 1 year, if muscle mass is adequate, you can give IPV to the deltoid muscle of the baby. Okay, so, and not only that, always keep it in a mind. Um, if you are taking any vaccine, make sure that you are fit and you are healthy. Then only you have to take a vaccine, whether it is a child or whether it is an adult. So make sure that there is no fever, no cold, no cough, or any debilitating symptoms, or any sort of like any sort of health problems, health related problems. Just kindly, you have to kindly recognize if you are feeling anything discomfort regarding health and all. First you have to tend to the doctors, sisters, or ANMs, ASHA workers, health secretaries, everyone. You have to mention that if you have any health related problems, try to tell them. And based upon the severity, or based upon the symptoms and all, they'll give you the vaccine. And not only that, if anyone who suffered polio, because of polio, sometimes it can be treatable. Like at the time of only symptoms, we can do symptomatic management, like fever and all, diarrhea, fever and all. It can be manageable. But in some cases, some people get adversely affected, because it can be the spinal cord. So there is a chance of paralysis, weakness, muscle pains and all. If any symptoms like alarm symptoms, you have to you just go and tell to the hospital. I mean, tell to the hospital or tell to the hospital administration or a doctor. Just You need to uh, like rule out any sort of problem through investigations, diagnosis, and you should get a proper treatment. So in some people who are suffering from polio, they'll get cured, but in some people there will be like residual paralysis, like residual paralysis will exist. They are healthy, they are perfect, but because of that residual paralysis, that deformity will just remain. And not only that, you have to also take care that recurrence of polio is also one of the serious problem, like previously suffered polio affected people and all. So any recurrent symptoms are you are suffering, or any recurrent symptoms are or any persons are experiencing, whether you people are experiencing any bad symptoms or not, you have to thoroughly take care of yourself. You have to thoroughly examine yourself, and timely get the proper timely you have to get the proper consultation from the doctor. Okay, you need to consult your doctor, and you need to get evaluated. Okay, and each and every child is very very special, and we should eradicate polio. And please support the government, please encourage polio vaccination. 2 drops of OPV is must for every children. Not only that, please follow the proper schedule of the polio vaccination. Thanks a lot, everyone.